Like if all you're seeing on your Instagram feed is hench guys, you know, then that's gonna fuel
It's true.
that feeling that you have that I'm small.
Yeah.
I need to get to the next level.
I always find it funny as well. Listen, of course, we're not going to sort of name names and jump on celebrities and all that stuff, but I do find it funny when you've got, 50-year-old celebrities looking the best they've ever looked in their life.
Yeah.
Looking like the Hulk. Looking like Incredible Hulk. And then they'll tell you it's all natural. I'm eating chicken breast, I'm eating broccoli. And you're thinking, come on, man.
Halfway. Take a few steps back to go.
You ain't got the answers, man.
What's going on, guys? It's the Goodman Factory presenting Checkin In. We've got myself, Kel, my boy Aleem. Today, obviously, you see us in the football shirts. I have to pick up myself, Arsenal first. We're going to win the league, 10 games left. Aleem, how you doing? He's come with a Palmer kit. He doesn't want to rep an England team today.
Italian legends.
So obviously, as you know, it's myself, Kel. We've got Aleem. We're both medically trained doctors, GP trainees. Today, we're doing all things testosterone. Aleem, how you doing today?
I'm good.
Yeah?
Yeah.
Why don't you bring your United kit today, man?
I'm waiting till we're top of the league like Arsenal. Maybe next season.
So this is the start of our journey, man. We're dominant now, man.
Yeah. See how long it lasts.
So obviously we're doing testosterone today. How do you want to start us off? Let's give a general overview, I would say.
Yeah. Obviously, testosterone is one of the main hormones in the body. Men and women have have testosterone.
Yeah.
However, it's in larger concentrations in men.
Exactly.
And it's got a number of roles in the body. Obviously, mainly we think of puberty, and it's responsible for the development of secondary sexual characteristics.
Yeah.
But if we think of the adult male, we think of a number of other things. Most people probably think of testosterone as a driving factor of masculinity.
Yeah.
Muscle development.
Yeah.
Libido, male vitality. But yeah, it's got a number of effects.
Yeah. So as you touched on, obviously puberty, adulthood, even when we're sort of developing in our mother's wombs, it's even having a role. So it's a very important hormone. And I think it's even important to touch on that, it's both in men and women as well.
Yeah.
I think that's a misconception that it's only in men. The important thing, I guess you touched on again, is that it sort of relates to a lot of our identities as well as men. And I think obviously some of the things we'll touch on today are in regards to infertility and things like that and low testosterone.
Yeah.
I think more from the sort of psychological side of things, there's probably an element of people feeling a bit demasculated if maybe their testosterone levels are a bit low, which obviously is not the case. But we'll touch on a bit more of that a bit later. But yeah, let's touch on, I guess, first thing we could talk on is the general sort of roles it plays as an adult, I guess, because there's the obvious ones in terms of male aggression, which is appropriate. We need that in life. Sometimes you have to be aggressive. It's not every day soft. And then we also obviously it helps in terms of muscle development, etc. So let's touch on the basic things that people might not be aware of with testosterone's roles.
Yeah. Well, I guess you've mentioned.
No. There's more. I know you know this.
But obviously, in terms of oxygen, EPO as well.
Yeah.
Testosterone has a role in that as well. Has a role in sperm production as well.
So just something we'll touch on a bit more in detail. Exactly.
So I guess with fertility,
you
need to have good quality sperm. In order to have a higher chance of having a child.
Yeah.
What else are you thinking?
I'm thinking, this guy, I'm bringing an exam question. No, joke. No, I guess you touched on all of that, even cardiac function, I guess. Do you know what I mean? Some of the cardiac function in testosterone will influence as well, like your cardiac output and things. Yeah. We won't get too technical, guys. Don't worry. Do you know what I mean? But those general sort of things, it will help in regards to that. Where these things become more relevant, I guess, is in abuse of testosterone, I would say. And also, obviously, you need to consider it in terms of if you're administering testosterone for somebody who needs it. Just because in excessive levels, some of the effects can, be detrimental in a way. So we touched on sort of the EPO side of things and the influence it has on blood. It can sort of thicken your blood up a little bit and things like that. So
risk of strokes.
Exactly. So that's where the worry comes in when you're using excessive amounts of testosterone. But we'll touch on that because obviously we live in a time where I think it's probably become a little bit more mainstream in terms of gym culture and things like that. One of the things we want to touch on today, I guess, one of the domains of testosterone, I guess, is its relationship to gym culture, really. And even just touching on body image and things like that as well. So what's your take on it? Obviously, as a gym goer yourself, you know, what's your take on it?
I think definitely gym culture has increased over the years.
Yeah.
I remember being in sixth form and maybe a handful of people
Yeah.
in my class, which was a boys' school.
Yeah. Oh wow.
Let's say
That's tiny for that.
going to the gym.
Yeah.
Okay.
Yeah.
If we fast forward to now, you're seeing lots of school kids in the gym. So it's becoming a lot more popular.
Yeah.
And obviously things need to be done in moderation. And if people are constantly exposed to images,
that's what I was going to say. Yeah, because I was going to ask, why do you think that is? Do you know what I mean?
Yeah. So if people are constantly
Yeah.
exposed to these images of muscle, of high performance, and that's their aspiration,
Yeah.
you need to think about how do people get to that.
Yes. Yeah.
And let's say, are they comfortable
Yeah.
doing things within their limits?
Yes.
Or do they feel
They need to go above that?
How can I push my
Yeah.
limits?
Yeah.
So it's a tough one, and I think probably things like bigorexia, which has been mentioned in the past, body dysmorphia.
Yeah.
It's becoming more of an issue now.
Definitely.
Probably not to an extent whereby we're seeing it everywhere.
Yeah.
But compared to, let's say, 15 years ago,
definitely,
people are maybe more likely to indulge in unhealthy habits to try to push themselves to the limits.
You see it bumbling in the background a little bit. I always find it funny as well. Listen, of course, we're not going to sort of name names and jump on celebrities and all that stuff, but I do find it funny when you've got, 50-year-old celebrities looking the best they've ever looked in their life.
Yeah.
Looking like the Hulk. Looking like Incredible Hulk. And then they'll tell you it's all natural. I'm eating chicken breast, I'm eating broccoli, and you're thinking, come on, man. Because the disservice you're doing is for a lot of the younger people, to be honest, the ones who are a bit more impressionable. Us as adults, especially as medical professionals, we can look at people and think, come on, man, like it's, there could be a likelihood that you're on something. But yeah, it's for the younger ones really that, you can lead them astray a little bit by not being honest and open about it. And I do think as time goes on, those conversations will be had more. You definitely see some people who are more open now about their usage of testosterone and other sort of anabolic steroids, etc. But yeah, more honesty will definitely help.
I think what's important is people having a positive body. Well,
yeah.
Firstly, to understand what healthy looks like.
Yes, yeah.
And having a positive body image.
It's true.
So if you're an average guy, what's the average height? 5'10", 70 kg.
Not 5'10", please. Please. Let's bring it down to 5'8".
Okay, let's say 5'8", 70 kg.
Yeah.
That's average weight for a guy. Okay. But if you're trying to be, let's say, 5'8", 100 kg.
Yes.
Of lean muscle.
Yeah. Ask yourself.
So it's about having a realistic idea of what healthy looks like.
Definitely.
And being happy with that.
Definitely.
And if you look in the mirror and you see someone that's healthy, that should be enough.
Yeah.
Because when you look in the mirror and you're not pleased with what you see, then that's what can potentially
become a slippery slope. Yeah.
And when we think of body dysmorphia, we think of bigorexia.
Yeah.
It's more than just wanting to be bigger.
Yeah.
It's the kind of gym culture being pervasive.
Yes.
In terms of you don't even want to go to the cinema. You don't want to do anything that's not gym related.
It's true. It's true. You're wearing long sleeve because you're thinking the pump is not there today. So
exactly. You don't go gym for a week and you're thinking I've lost gains. So it's about trying to avoid those unhealthy thoughts.
Exactly.
Because then they drive behavior.
Exactly. Because one thing we touched on in episode 1 obviously is having a healthy relationship with exercise, etc.
Yeah.
But as you've said, if you are doing things excessively, you're almost it's misuse of what should be a beneficial thing in your life, to be honest. Excessively going to the gym, etc., as you've touched on. Because then you need to look at what your actual priorities are and what you're trying to achieve from it.
And that might mean limiting your exposure to certain stimuli.
Yeah.
Like if all you're seeing on your Instagram feed is hench guys, and that's gonna fuel
It's true.
that feeling that you have that I'm small.
Yeah.
I need to get to the next
Yeah.
level. So it's like they're bad behaviors, whether that's overeating, whether it's not getting good sleep because you're spending hours in the gym,
Yeah.
and then there's the possible exogenous
Usage
of testosterone.
Yeah. Which becomes a problem as well. So yeah, I guess it's one of those things where there's no easy fix, but definitely having more conversations about it should at least give people, because the sad thing with these things is people will use it if they want to use it.
Yeah.
You can't stop people from using it, but at least if people are a bit armed with information, and the potential adverse effects, etc., at least they can make a bit more of an informed decision for themselves. But you do definitely see it from a clinical sort of point of view. You get people coming in sometimes who have used steroids, and because obviously of the way the body has its own way of regulating things, that usage sort of causes problems from that point of view, and sort of shuts down your body's own production of hormones itself. So I guess people knowing a little bit more about their physiology, etc., would probably help them in terms of maybe avoiding unnecessarily doing that to themselves.
Definitely.
Yeah. I guess another big and like pertinent topic relating to testosterone is infertility. So we'll touch on that today because it's something that affects a lot of guys and a lot of women as well. A lot of couples, we should say. Where do you want to start with that?
I guess with that, we need to think of what's testosterone's role in fertility.
Yeah.
And obviously, testosterone, the testes produce sperm. And obviously, if you don't have testosterone, then you're not going to produce, if your testosterone's low, your sperm quality is going to be
poor as well. What we touched on sperm quality, and not to get too technical, but people might be thinking, what is sperm quality? Because if you say sperm quality, do you know what I mean? What does that mean? But I guess that would be sort of volume of sperm itself, the volume of mobile sperm cells within that as well, within the semen sample, we should say, and then just the volume of sperm cells as a whole within that as well. So yeah, those, I think, sperm, so that people just know what is sperm quality.
I think you just said it. Or in your words, what would you say?
No, that's how I did. But
yeah,
maybe it's not even that relevant to people, I guess. But just so they know, just from that point of view. But as you were saying, the low testosterone levels will impact the quality of sperm you're producing, and then obviously as a knock-on effect, your likelihood of conceiving of your partner getting pregnant, etc. So that's the relevance from that point of view, and I guess it's important because it can, obviously I've not experienced that myself, but it can be something that is, I'm assuming, is extremely frustrating. Demoralizing, of course. A lot of the times, especially, I don't know, maybe it's a cultural thing as well, but you can see a bit of a blame culture as a little bit in terms of who's to blame almost. Is it the man, is it the woman? Which isn't the case, with these things. Sometimes physiology can have this sort of hiccups in that, from that point of view, which is a lot of the times outside of people's hands. But yeah, what are the sort of general, what would someone do? Someone comes in with, and they're concerned about infertility. What would the sort of alarm bells will ring in your head, or what would you feel as though you want to sort of touch on, I guess, in that sort of situation?
I think with fertility, you want to have an idea of what are they doing at the moment. Are they regularly having sex? Okay, because if they're having sex once a month, they might not be having sex at an optimum time to promote fertility. Okay. What other lifestyle aspects could be at play? Are they smoking? Are they drinking alcohol?
Yeah.
Are they overweight?
Yeah.
Are they having lots of really hot baths?
Going
to the steam room. These things they tend to avoid.
Yeah.
Are they maybe using anabolic steroids as well? Are they self-medicating?
It's true.
Okay.
It's true.
So if these factors aren't really at play, they're regularly having sex with their partner, but it's been, let's say, a year or so, and she's been unable to conceive, then you would probably be thinking more could be at play.
Yeah, at play. Definitely.
Okay. And then there could be maybe other systemic risk factors, if they're on long-term steroids.
Yeah.
That's something to consider too. So those are things to consider, I would say.
So a lot of it is accessing your GP, etc.
Yeah,
in the first instance if you're concerned. and getting those investigations. Obviously, we're speaking from the male perspective, but they will obviously investigate
both partners.
Exactly, both partners in that sort of situation and go from there. I guess another big issue, and this is what I felt as well, and we sort of touched on it, I guess, is the psychosocial side of it as well. Because one of the general things alongside all the investigations, etc., is they will look at the counselling side of things. And this is what I meant at the start in terms of testosterone and a lot of the sort of body functions it regulates. I don't know if it's the link to testosterone itself and the association it has with the male identity, but a lot of it sort of impacts people's own confidence. And that will be, as we've touched on, from a gym culture point of view, or from an infertility point of view, or from, someone who maybe gets a diagnosis of low testosterone and the impact that will have on them psychologically. But I guess another big domain is people with infertility. One of the big things that they need, obviously, is counselling, from that point of view, just to, I guess, allay any sort of fears they may have that it's their fault or, there's something wrong with them. But also, I guess, to also be realistic in that sometimes, people are infertile and, in a way that can be a norm in a way as well. So, So I think it's the counselling side of things is also important as well. It was also an important aspect as well.
I know you're enjoying this conversation, but I'm here to remind you that this episode is sponsored by Goodman Beard Oil, plant-based, chemical-free beard oil to soften and moisturize your facial hair. Order now, goodmanfactory.com, and use code GPOD1 and become a good man today.
So if we touch on other symptoms or signs of low testosterone.
Yeah. You start.
So I think, like we said, struggling to put on lean muscle mass.
Yeah.
That's one. Although I think that's a tricky one.
I was gonna say
because someone someone can say they're struggling to put on lean muscle mass.
What are they doing?
They're going to the gym.
Yeah, once a month.
Yeah. Or even once a week.
Yeah.
If you've not got the core ingredients of building muscle, which is good sleep,
good diet,
calorie surplus, and an effective
program. Yeah.
You're gonna struggle.
Yeah, definitely.
So obviously that's one. Other signs could be loss of facial hair.
Yes.
Also, gynecomastia. Is one.
So how define that? Because that one you're using technical terms.
So essentially, male breast tissue. Is a way to define it. Another one which is quite important is, you don't tend to see it until someone's had, let's say, an accident or so let's say a fall, but fractures.
Yes, yeah.
So we tend to get young men who present with fractures that you wouldn't expect or you'd expect in the elderly population.
Yeah.
And that is usually due to low testosterone. So they end up needing referral to endocrinologists. So those are some of the symptoms.
Yeah.
But there are quite a few, like low libido.
Yeah, and some of them as well. That's the thing that is tricky with low testosterone as well, because even if you look at, I guess, things like not developing lean muscle mass is a bit more of a specific one, but a lot of the symptoms you'll get,
quite non-specific.
Non-specific, a lot of overlap with other sort of
low mood.
Exactly, low mood,
irritability.
Exactly, lack of motivation, things like that. So a lot of them will even overlap with more so depression-like symptoms, anxiety-like symptoms, which makes it tricky, I guess, to pick up. A lot of the times people know themselves and know their bodies more than us as professionals even do. So I guess if there is something that seems like a deviation from norm, or it's been going on for a while without any sort of real underlying link or association they can pinpoint, I guess that might in some cases be worthwhile seeking some further investigations, etc. But it's tricky though. It's tricky because I don't think, if you look at the list of symptoms, I don't think any of them are specific, to be honest.
Yeah. I guess the ones you'd maybe think are more specific are, let's say, the lower libido, the erectile dysfunction.
Yes, that's a big one, exactly.
Possibly infertility.
Yes, exactly. And those two things are probably the ones where testosterone levels go to, they're going to be checked. Infertility and erectile dysfunction, definitely you're going to check it in those sort of circumstances. But to be honest, someone comes into you're not going to think, okay, this
fatigue you get in how many different things.
Exactly. So it's tricky from that point of view. But of course, a lot of things are diagnosed with exclusion. So, you know, it could be a case of you rule out everything else. And the last thing really to check is testosterone, in which case, of course, it makes sense to check that. But it's tricky, but those are the symptoms I think really people can sort of look out for and keep in the back of their mind, I guess. Obviously, as people start to age a little bit as well, you're expecting that testosterone levels will drop as well.
Yeah. So from probably your third decade.
Yeah.
So probably from your 30s.
Yes. Probably important to say, not to a point of...
Yeah.
Exactly. So not in the initial stages, whilst things will start reducing, it's not going to... You probably won't even notice it, to be honest. You probably won't even notice it. And I think, to be honest, some studies show that in older populations, obviously you can have that reduction, but some men, their testosterone levels are normal for their age at the time. So it's... In which case, if you think about it, you won't really even have any symptoms with that. I guess another sort of interesting topic is the possibility of almost like male menopause. And it's something that you hear thrown around here and there.
Yeah.
Obviously, you know, there's no sort of guidance or anything for it at the moment, but it's something that I guess you probably heard it yourself.
I've heard of it.
Yeah.
I've heard of middle-aged men
Yeah.
taking testosterone replacement and getting symptomatic benefits.
Yeah.
Whether that's with their mood,
Yeah.
their energy,
Yeah.
building muscle.
Yeah. Yeah.
But again, it's something that doesn't come without risks.
Of course. Of course.
Especially when we think of prostate cancer.
Yes.
There is some links to suggest that it can increase the risk of prostate cancer. So it's one of those medications that you can't really toy with in terms of self.
Yeah, exactly. And that's, I think that's the worrying thing, that a lot of people obviously who are using it, whether for recreational usage or, you know, with a gym context or for whatever sort of indication, obviously they're doing it they're doing it from their bedroom.
Yeah.
They're doing it from the bedroom. That, you know, I think some people, to be fair, they're getting regular bloods and things done as well, but still you are sort of self-managing yourself, which is worrying, because obviously the adverse effects are serious adverse effects, to be honest. But I do think, to be honest, I would not be surprised if at some point we start seeing testosterone being given in smaller doses to older men, just to help from as you know, in the areas you've described. I think, to be honest, I could see it happening. Yeah, I could see it happening, to be honest. I even think it would make sense, to be honest, in some
possibility. If it's like closely monitored.
Yeah, exactly.
And not abused. Okay, so we've touched on quite a bit from, let's say, adolescence, when you're a young teenager, the role testosterone has in terms of driving secondary sexual characteristics. Also, we've touched on body identity, which is quite an important issue.
Definitely.
One that's not had, you know, as men, we don't see ourselves as sensitive and vulnerable.
It's gonna you'll see more of it, definitely, I think.
So it's a very important issue. Then moved on to, let's say, following your peak testosterone years. Obviously, testosterone levels are still high.
Yeah.
And we've touched on the symptoms of low testosterone.
Yeah.
Such as low libido, erectile dysfunction, infertility, change in mood, difficulty building muscle mass. And then we've now kind of descended onto older age, the male menopause, and the role of testosterone replacement. So we've kind of covered testosterone.
Yeah.
Maybe we can see if there's any questions.
Yeah. Can touch questions as well. Yeah.
All right, guys, we got some questions from the Goodman community. First question: I like seeing you, man, doing your thing on the doctor scene.
Come on.
Big up yourselves.
Yes, today we're bigging up ourselves, man. It's Arsenal Day. I'm gassed. Do you know what I mean? We're bigging up ourselves, man.
Don't get carried away.
Sure, man.
But man's got a question for you. What is the link between low testosterone and infertility?
So we touched on that a little bit during the episode, and it's more so from the context of low testosterone and fertility. Because obviously, if you've got low testosterone, it's going to impact what we call sperm quality. So the amount of volume of sperm you're producing, the sperm cells themselves. And then that obviously has a knock-on effect on if you're, you know, how likely you are to have kids, essentially. I guess you could look at it from the angle of both if someone has had kids previously and if it's their first time trying as well. Because I think people need to be reassured that it doesn't mean if you've had kids previously and you're struggling now, you can't have kids again because your levels are low, etc. It just means you might need some further investigations, both for you and your partner, just to work out if there's anything that could be corrected, for example. But doesn't sort of rule out that you're going to have more kids, basically.
Yeah. I guess despite having a low testosterone level, there are things they can do to further optimize their fertility.
100%.
Like we mentioned, smoking,
Exactly.
alcohol, weight loss.
Exactly. And that even makes sense from the point of view of, if you think about it, if someone's had a kid 5-10 years previously, a lot of lifestyle changes can happen in that period. So as you said, there are things definitely you can correct. Just to sort of bring you back closer to where you were previously, lifestyle wise, that can increase your likelihood of having kids, basically. So therefore doesn't rule you out, definitely.
Okay. Second question. Okay, I'm gonna phrase this one to you. Let's say I'm a man in my mid-30s.
Yeah.
Fit, healthy, no past medical history. I'm going to the gym, hitting the gym 3-4 times a week. Eating consistently, getting good sleep.
Yeah.
I'm just not putting any muscle mass.
Then I don't believe you. I don't believe any of that. No, I think it's a legit concern, but you have to look at all those 3 domains and really ask yourself, are you really getting quality sleep? Is your diet actually optimum as well for muscle growth?
Yeah.
And also, not even just are you going to gym. You can go to gym and just walk around and be snapping, be taking snaps, be doing Insta Live.
That's true,
Doesn't mean you're doing anything.
True.
Your program needs to be conducive to muscle growth as well. But at the same time, if honestly those things are all, they're all well controlled, you're doing well with all those things, and still you're not developing any muscle, there could be a genuine sort of endocrine issue, could be a testosterone issue.
Yeah.
In which case, it's worthwhile going to your GP and at least having a discussion with them.
Exploring all the symptoms.
Exploring all the symptoms. Potentially, it might warrant getting your testosterone levels checked, etc. But also remember that there's other things that can impact muscle growth as well. You know, so it's not just testosterone. But yeah, definitely seeking your GP's advice will be the first step, I would say.
And I think a good point as well is, what do you look like?
Yeah.
If you look good, but you're trying to push boundaries and I don't know, maybe you're going for Mr. Olympia or something. You know, if you look good, you look healthy.
Yeah.
Then, are you trying to supplement your testosterone levels, or it's like sometimes we need to be content with how we look.
So it's also, I guess, about managing expectations, let's say, I guess, in terms of your body image.
Yeah.
You're not going to be looking like Hollywood stars, because I've got something to tell you about Hollywood stars. They're not eating chicken and broccoli, but yeah, just look at those things, I would say, as well as just being honest with yourself, and if you're happy with your own body image, of course.
Okay, so I'm just going to throw a hypothetical scenario to you.
This guy loves that.
So, yeah, I'm just feeling tired all the time.
Yeah.
Could it be my testosterone?
Yeah, okay, let me not get fatigue. But you know what? Fatigue is something that many things can impact. So yes, it could be your testosterone. But I think if you were to ask most clinicians, they're not going to go for testosterone straight away. They're going to think of more common things. One common phrase is common things are common. They're going to look at things that are a bit more basic, easier to correct.
Yeah.
If all of those things obviously come back negative, then then it might be worthwhile checking your testosterone, probably in the context of looking at if you have other things with fatigue as well.
Yeah.
But yeah, it could be. I've had patients who their initial symptom was just fatigue. They've got testosterone checked and it was, they happen to be low. But yeah, I would say from the clinical point of view, probably would check other things first and foremost, to be honest. Yeah.
And I think going off that, if you're someone and fatigue is a symptom that's affecting your life, your quality of life, then don't hesitate.
This is it.
GP.
This is it. Earlier,
you get reassurance, or you get medical help, the better.
Exactly, especially if it's debilitating.
Yeah.
If you're having fatigue that is really impacting your day to day, then forget about if it's testosterone. Just go and see your GP and get some further checks done. Definitely. All right, guys, we're wrapping up now. Want to say thank you very much for tuning in for this episode. And before we go on, to thank you as well for tuning in to the first episode, being very interactive. We had a lot of feedback from you guys. I think you need to remember we're community-led. So we love it when you interact. We love it when you leave questions. Whether good or bad, just leave something for us. We'll come with more for the next episode. Don't forget to like. Don't forget to leave more questions. Don't forget to subscribe as well. We'll see you again. We've got more for you guys.